deemed in science, they are laboratory now applicable away to the OT, just simple application of stem cells. I'm Dr. Alkazaz, plastic surgeon for 65 since 1995. So mostly I will talk about the clinical application and how much the stem cells has been changed my practice in the last 10 years. We are a plastic surgeon, mostly we dealing with the tissue, so all the cases I will present is adipose mesenchymal stem cells, that only from the fat cells. We know we are plastic surgeon, we're dealing every day with the tissue. Unfortunately, every year, the number one cosmetic procedure is liposuction, body contouring, and million of liter of fat tissue is thrown in the garbage every year. And unfortunately, this is a very rich tissue with stem cells. Yesterday, in my presentation, we talked how important it is. How important this tissue healing, because important because availability, easy to get it, important because activity, we talked about it all in detail yesterday, I don't want to go again to it. So we know how it is important, 1,000 times can get stem cells from it compared to the bone marrow or umbilical cord or Wharton gel. So I'll talk today only clinically. We are a plastic surgeon, how we are using it. Either we're using it cellular or acellular. Acellular, to be honest, is increasing only last a few years and more in cosmetic, but to start to involve it in surgical. But as a surgeon, we need more the cell because of other function of the cell other than paracrine. We need the cell for differentiation. How we are preparing, how we using it. When we take a fat, we have two options. Either we send it to the lab will be identify the cell, not mesenchymal stem cell can use it for treatment, should be specific CD marker. So the lab will isolate it, culture it, expand it, the lab will decide the amount, we don't have a role in it, according for what we need this treatment. Then they give it back to us within 3 to 4 weeks, then we start to do the surgery and use it. Another option that we are the one ready-made, we call it, that we are the one who prepare the stem cells. Usually we have two types of prepare it, either mechanical or enzymatic. In the old days, when I started 16, 17, it's not allowed to use the enzymatic. For mostly I was using, mostly we were using the chemical, mechanical. Mechanical give us less in number and less cost to the patient, 15 minutes to prepare it, and the good thing you can use it in the office space. If you have a procedure room, it's allowed to use it because in authority in Dubai, you can do liposuction for 50 cc and less. So this one need only 20 to 30 cc. Or we are enzymatic, that mean is more manipulation because we use an collagenase. This one we need to prepare it in the OT session by us, the DHA or any other authority. And to know that the difference between a culture cuspid is a pure stem cell, they give it to you. SVF is contain part of it is mesenchymal stem cell. There's another cell of it, even hematopoietic stem cell, progenitor cells. The percentage of stem cells in it 1 to 30%. There's many reasons for this big difference. We spoke about it yesterday. But to be considered as valuable, we need at least 500,000 of cell, which is nucleated, not stem cells, in per cc, and should be viability at least 70%. So these are the applications that has in the plastic surgery that has been approved in many studies from level 1 to level 2 cases report. I already use it only that has been approved application. Number 1 use in plastic surgery, the stem cells, we are mixing it with the fat. Why we put the fat already the richest tissue in the body with the stem cell, but why we need to reach it with the stem cell? Because when we aspirate it, already spoke yesterday, the stem cells is around the blood vessel. Sometimes when we aspirate the fat, we leave the stem cells behind us in the donor area. Or sometimes the processing of the fat, we lost it in the fluid that, because most of the surgeons, they do decantation and washing. Then they get rid from the stem cells, unfortunately with the fluid they discard it. So to improve the quality of the fat that we are using it, we need to add the stem cells. As a plastic surgeon, when I have a case, when I think I need stem cells, when I have poor blood supply, when I have a blood fibrosis, when I have a problem with post-operative complication, today, last 10 years, the stem cells really is my backyard.
When any time in a problem, or we want to avoid the problem, we think immediately about the stem cells. So I'll start to present it as cases to show how the difference between a plastic surgeon who is a regenerative plastic surgeon from regular plastic surgeon. I spoke about the breast because this is my field of interest. Maybe other surgeons more interest in hair transplant or facial rejuvenation. I talk about the breast and body because this is mostly my interest field. The breast, I'm using it augmentation, congenital deformity. I'll give you just the difficult cases, how big are different. This is simple case. We just augmentation. Patient, she want 1 cup larger. She don't want an implant. So it's solved just by fat transfer, not difficult case. But here what I'm talking, because we don't have a guideline. Why I decided cases, culture expanded, why I decided cases SVF. This patient, why I decided for her SVF? Because these, in short time, less than 10 years, she will be menopause. Menopausal women already enlarge breast if they have a lot of fatty breast. And glandular tissue always change to fat. So impossible to put for her large amount of stem cells. Otherwise, you have a problem with large size breast. For that, I select. That was mean. I'm using my common sense because I don't have any guideline when to use the SVF, when to use the culture. While when I deal with such a case, she come for surgery. The patient before she come, if we see her, she came for abdominoplasty, was secondary the breast. But the patient when she come, her aim is to improve the shape of the breast and asymmetry. In this case, I go to the culture expanded. I need higher survival of the fat. In the old days, before the stem cells, we cannot give this result unless we go to the 2 session or 3 session. Now we can solve the problem in 1 session, although we are not promising the patient will be in 1 session. So even if the patient pay more for the culture, expanded stem cell, but it will be cheaper if they go to the 2 session and the 3 session surgery. Tuberous breast, one of the complications, it is congenital anomaly, 4% of it by study, but if we do any study in the Gulf area, every week I receive more than 2 to 3 cases, even for other problems they come, they have tuberous. I consider it as anatomical variation more than congenital anomaly. The problem with this lady, they don't have part of the breast, either quarter they don't have or lower half. Why they don't have it? Because during embryological development, there is fibrous tissue constricting back, kill the mammary buds. So when the girl grow, there's no grow part of the breast, either quarter of it, consider type 1, or half of it, type 2, or sometimes type 3, 3/4. So this is very challenging, and it is not related to the shape or size of the breast. It's a shape problem. Could be larger breast, is still tuberous. So the problem that we have very short this distance, we need to expand it, and also very bad because there is constricting bad. As a surgeon, we need to release it. Fibrous tissue, that means we need a stem cell. Tight skin, that means will be high pressure inside, like this case. If you see, this is very challenging, this one, because we see very short, tight skin. She has no history of a pregnancy. This is short distance, 2 centimeters. How I will be able to make it 5 centimeters, 6 centimeters? If I just put the fat will not survive because it will be high pressure inside. It will kill all the fat I put it. But when I put stem cell and I use for her culture, which is very good number, what will happen? The stem cell itself is activated by hypoxia. So this one in high pressure is for me advantage because it will stimulate more the stem cells. Because how they expand in the lab, they already take the oxygen, give CO2 to encourage the stem cells and activate it. For that, here the problem with this patient is not the size. We want to change the shape. We want to take her out of category of tuberous breast to women with normal shape of breast. While when I have such a patient, which is type 1, only she missed a quarter of the breast, I don't have tight skin. This is 22 years old. She lost 40 kg by diet and exercise. Here is not my problem, the pressure. So I don't need to go to the culture expanded. I don't need large number of stem cells. This how I figure it out. I don't have guideline. I just need my brain, just my common sense. Why do I need a large number of stem cells? She is young, naturally she have very good. I did for her lower body lift. I put a fat first stage. I use SVF only in first stage because I will do rhizotomy, release the fibrous tissue. So I have bad donor area, recipient area. So I need the stem cell, but not large number. And you can see it's very good the number for her naturally. And even the viability is very good because she is very young. And we've been able to solve the problem in 2 stages. You can see how much we expanded the base of the breast and also enlarged the size of it. This is another patient. She had very tight skin, tuberous breast, type 2. Any plastic surgeon, they think this many implant. There is no implant here. But if you can see this pigmentation here, this is pigmentation because I did meshing of the skin to expand it. I'm a reconstructive surgeon. When I have skin graft, I meshing it, expand it. I did exactly the same principle. I mesh it, I put it with here. I need large amount to solve the problem. So here I go to the culture expanded. When I need larger amount, I go to the culture. When the amount is not important for me, I go to the SVF. This patient, the same, I did only SVF. She don't want to enlarge the breast. All what she want that when she wear the bra can fill the right side, not the left side, different size. So we able to, in breast always we tell the patient, they are sister, not identical twin. All what we want to get is closer in shape, closer in size. They fill comfortably the bra. And we get this result only by SVF. I didn't go to the culture expanded. Here is very interesting patient. This patient, when she was 2 months, this is not her photo. I brought a photo equal to her case. She has cystic hygroma, surgery done when she was only 2 months old. When she growing, she end with deformity of the breast because already hygroma excised and affected the growth of the breast, affect the deformity in the shape of the arm and also lateral thoracic. When she usually abduct her arm, we have a linear contracture. That left is breast already lifted highly when she abduct the arm. Usually, what we taught us as a plastic surgeon, when you have linear contracture, just do W-plasty, Z-plasty. For me, and I always, everybody working with me, they know, I'm always not only thinking out of the box. I not put a box for me, there's no box. Always I'm free in thinking. Why do I need to do Z-plasty? Let me do just a transition of the scar and put this fat with the stem cells. And for her, because she's very important case, I did culture expanded, stem cell, mix it with the fat. Why? Because I have a lot of fibrous tissue. If fat will not survive, I have contraction, I need to solve it, and we've been able, this is result after 3 years. She came again after 3 years for second stage to enlarge the breast, but this is photo after only 1 stage. And we can see how much it make a difference. We shift her from these deformity in the axilla, in the arm, lateral thoracic, the shape of the breast. We improve. This is result after the first stage, and it gets better after the second stage. Also, it's very important for us when we have complication of a breast implant. When we see such a patient, she done in Canada, 3 surgery, she is massive weight loss, bypass surgery, very thin body. They put for her very large implant, then they discover the problem, they done mastopexy, then still the problem is there, then they take her to the OT. In the North America, they are crazy about the ADM, which is synthetic mesh. I don't think any mesh can solve this problem. The problem is still there. All what they done with multiple surgery, they damage the tissue. She don't have any more glandular tissue, very atrophic. She has very good quality of skin. She consults people in the US, in Canada, they suggest for her nipple sparing, mastectomy, and they put for her a free flap during her as a case of mastectomy. So when I saw this case, if I saw her 10 years before, I will not be crazy, I will never touch this patient. But when I have a stem cell, I know there is something can save me. There is a bad guard that will protect me in such a problem. So I suggest for her no more any implant. Or what we're going to do, we will remove the implant, put for you the fat, and with the fat we put the stem cells, and that's what we've done. Then you will ask me, how you get the fat in very thin patient? The patient, she accepts to do for her full buttock lift because already she has a buttock. And I use the extra tissue, I collect all the fat with it to make the fat available to make the stem cells and to solve the problem. This is another patient. She had also previous surgery. She has bottoming out. She done another secondary surgery. Both of them failure, inside UAE, outside UAE. When she come to me, no more implant, very poor tissue. We need fat, we need the stem cells, but for this case, because very also bad quality, the tissue I use for her culture expanded. And I've been able to solve the problem, then after 1 year I put for her the implant. This case is very important. I don't want you to look to the breast. My aim of this slide is not the breast. I want you to notice something. This is 25 years old after bariatric surgery. We every day see these patients. They look very old, like in 80s, and they are just at 25 years. Look to the quality of the skin of the breast. First stage, I did for her only lifting with fat transfer with SVF. Culture expanded. So I want to improve the quality of these poor tissue. Nothing, no implant. If you see the quality of this skin, how much is different from the quality of this skin. This is a result after 1 year, she came to put the implant. So I want you to compare only this skin and this skin. Compare the skin in her arm is equal to the skin of the breast, but compare the skin in her arm with the skin of her breast after 1 year. This is the magic of stem cell. It's not only it can play with the collagenase, even it's increased fibroblast in the skin. The thickness of the skin is improved. That's the only things I promise my patient that they will get results. Improve the quality of the skin. Like this one, you see her arm, this is like 80 years old if you compare it, while the breast back again to 25 years old. Also, whenever we have a fibrosis, this is very difficult case. Nobody dared to touch it, including myself before, because if we just put the fat here, the fat will go to the surrounding area and the depression will be worse. This she had done, I don't know with whom, very bad liposuction, superficial liposuction. And when I had the stem cell, I told her, I can help you, but we need the 3 stages. But fortunately, while not expected, in 1 stage, but culture expanded the stem cells, we able to control all these fibrosis. You can see how much the difference. I never expected I will get this result. Before 10 years, before the stem cells, I will never dare to touch such a problematic patient. No plastic surgeon will accept. In hemifacial atrophy, in the old day when we are teaching plastic surgery, hemifacial atrophy, do you know how we treat it? We treat it, we take the free graft omental fat, then omental tissue. Now then we have fat transfer, we start solve this problem, no need such sophisticated surgery. But this patient is not only hemifacial atrophy, he has very bad acne scarring with atrophic of the tissue and a lot of tethering. So when we tell this a patient with limited budget, you're going to do 3 surgery, it's better even save money for him if we use an SVF and we solve the problem in only 1 session. We're able to get this result only with 1 stage. This is another case which is osteomyelitis for 6 months. We can see what happened in the bone. All what I did debridement. I injected SVF cell in the bone. Besides, I mix it with the fat and injected all the toys because I know there's paracrine effect. Injected in the skin, the dorsum of the foot. We can see even the quality. This is history of a previous skin graft, a previous ulcer. We can see the quality. Before, you can see the number is power 7. We get very good number. You not expect. Before, nobody believed that the stem cells from diabetic patient will be good. If the diabetic patient hemoglobin A1C with diabetes under control, you still can get good stem cells. And even viability is very good. After this case, I found 1 paper that they found it, there is also good quality. It's not inferior the quality of stem cells in non-diabetic from the diabetic. This is acute wound, anaplastic. This is a tuberous breast. When we say the size is not an issue, I do that. There is no implant here. I use a localized tissue. Unfortunately, I end with this complication. No plastic. This is shocking for the surgeon more than the patient. When you have a 20 years old patient with this complication, usually any plastic surgeon, they will put just Mebo ointment, whatever, wait till it will heal, then he send her for medical tattoo. But usually I said, I always thinking out of the box, even though there is no box. What I did for her, I prepared, this is 2017, I don't have enzymatic SVF. I use mechanical SVF. I injected in the tissue and I used it for her PRF. Why I use PRF as scaffold to protect my stem cells, which is under. And also, as we know, PRF has ability to secrete slowly the growth factor. Fortunately, the problem has been solved. This is more than 1 year, the result you can see. We get back normal areola, which till now he told me how it's happened, I don't know. Nobody knows. But we get this good result. I told you it's biological magic result, the stem cells. It saved us from many trouble with the patient. So I'm lucky that the problem has been solved with minimal complication. This is the set that we prepare the mechanical, while selling it in Dubai as a cell therapy, al-Arifrex. Also, for scar treatment, this patient, she is a pharmacist. She used to work in Kuwait as a medical rep and she dealing with many plastic surgeons. 7 years she is suffering from this keloid. Keloid is painful, itchy. She done many times excision, intralesional keloid because she's a pharmacist. She know many plastic surgeons. They done laser, they done everything. All her aim is to be no pain, no tenderness in the scar. So, because she's understanding, I told her let us do experiment, and with cooperation of bioscience, what I did, I divided in three. First one, if you see, in this third, I excised it and put half of the stem cells. The quarter, I injected intradermally, like what we inject in Kinacol. The other one, I mix it with the fat and inject. This is after 7 years suffering. You can see, this is amazing. In 7 days, you can see sign of maturation. Its color has been changed just in 7 days. After 6 months, the only one who go quickly to the maturation is the one fat with the stem cells. And this is the same result they found it even in a treatment of alopecia. When you mix the fat with the stem cell, you get better result. There is a recurrence in this third, but because this is experiment, we not repeated the injection after 2 months. But she is in her surgery, usually in her experience, even after excision in 10 months become very active. Recurrent is still milder, but the one with we injected intradermally, we injected with the fat, better result. This is also a very interesting case. This is lady, she came from Spain to Dubai. She has a car accident, 17 surgery, 2 free flap failure, ended with multiple graft and deformity. She is happy that they saved her leg from amputation, but her life is a hell since the accident. Why is that? All the lower limb is very sensitive. Even if nobody can touch it, even the bed sheet movement on her leg is intolerable pain. She has always severe pain because there is a screw here. This patient, she studied herself about the stem cells. She came to Dubai. I did for her 3 sessions. This is after the 2nd session. If you see this video, I'm comfortably touching her movement. I help her to improve the quality. In pain disappear from 1st session. Now, if she go back to Spain, they will do for her excision of this scar and edge-to-edge closure. Because they saw that she got such improvement in insurance, medical insurance in Spain, they accept to cover for her the expenses of a treatment in Dubai. Now it's easily, she can remove all these bad scar is attached to the, not even periosteum, to the medulla. This is very interesting case that prove that there is something called paracrine effect of that. This patient, she comes from London. I did for her lower body lift. She saw herself that there is improvement of the acne scar keloid that she has it in the shoulder. This is the right shoulder, this is the left shoulder, this is from the patient mobile. When she come in August, I did for her a second stage because she's keloid forma. I did for her upper body lift. I injected SVF not in this area. I injected in my wound. But the patient, in less than 2 weeks, she told me, doctor, see how much improvement in my acne scar, keloid scar in my shoulders. No injection here. This is to prove the paracrine effect of the stem cells. I injected in my wound area, but this one in the shoulder immediately. Can you imagine in 2 weeks this improvement? There is no study has been published about this result in 2 weeks because she traveled in less than, she did surgery 3rd of August, she traveled on 21st of August. This is hidradenitis suppurativa. All of you dermatologists, plastic surgeon, we know this is our nightmare. Nobody published till now any clearance for 3 years. I did it myself, my personal protocol. I did laser subcutaneous. I inject fat mixed with the stem cells in the area, and intradermally I inject the stem cells. Then after that, I start to search for any trials. There is one trial, it will be finished in this October, but they found only in the 1st stage, 2nd stage, that symptomatic improvement. in the disease, but because here I added also the laser with it and I mix it with the fat. For them, they only inject the stem cells. For this patient, the problem not what you see in the thigh. Real problem is genital area. We know the hidradenitis suppurativa in axilla, submammary, in the genital area around the anus, around the vulva and the labia majora. For this patient, she used both these two patients different. Each one of them, every month she have recurrence of pustule. All her life, all the year she is on antibiotic. For this, a life-changing really. And nobody has published such an improvement. I think my time is off. I don't want to talk more about this case. It's also a mechanical. Give the chance for my colleague. What we need to say at the end is a big changes. We are in the OT, but always we need in help of our colleague in the lab. We need the scientists. It is a team collaboration to get benefit of this regenerative medicine in our daily practice. Thank you very much. Now I will be honored to present my colleague, Dr. Hassan. He is very known among the Society of a Plastic Surgeon. He is not only good a plastic surgeon, he is a trainer. He has very good experience in training and also academic lecturing. Welcome, Dr. Hassan.
Thank you very much. Assalamu alaikum everyone and good afternoon. Thank you Dr. Sham and the organizing committee. Dr. Sahar, very nice